Right, so welcome back guys. So now in this session I'm going to start with the communicable diseases guys, and basically in this particular series I will be starting with the very basics. Okay, so some basic definitions must be known by us before entering basically into the diseases, right? So we'll be actually dealing with the several kind of definitions, right? And then we will be moving on to the separate diseases, right? So this particular series will be very helpful guys in your other subjects as well. For example, in understanding the infectious disease in the medicine part, right? So that will be very helpful. And overall, whenever you will be actually approaching the patient, whenever you are seeing the patients in your wards or in your emergency or in your OPD or somewhere else, right? So it will be giving you the immense confidence in actually dealing with the patients, right? Because you will be knowing so many of terms which you are generally using, right? For an example, whenever this COVID-19 came into the picture, so it brings many important things from this particular epidemiology into the particular community, right? For an example, we were not known about the herd immunity concept. We were not known about what is the different terms which we are using in the vaccinations, right? So many kind of things we came to know whenever this COVID came as well. So in this particular chapter or in this particular session, I will try to introduce you with some important definitions which are very important for your clinical practice as far as other subjects are concerned, and as well as for your MCQs and exams as well, right? So let's start with this particular chapter guys. Okay, so I hope you will be enjoying this, right? So okay, so in the epidemiology of the infectious disease, right, I'm going to start with very first, that is the what is infection, right? Because I'm going to talk about the infectious disease, so first of all we should know what is infection, right? Anyways, you know this, but still first I'm going to talk about what is infection guys, right? So if you talk about the infection, basically this is entry of an infectious agent into the body, right? So if I'm saying entry of an infectious agent into the body, or I can say into the host, right, that is simply called as your infection. Second important thing is, okay, I'm just generally talking about very basic first of all. Second, after the infection we shall talk about what is infestation, right? Sometimes they ask you these kind of one-liners, what is infection, what is infestation, right? And they will try to confuse you with the options by giving the definitions of several important terms, right? So for example, what is infestation? Very simple again guys. Infestation basically the presence of any arthropod, right? Presence of any arthropod or presence of any vector on the body surface, that is simply called as, for example, presence of tick, okay, on the body surface, right? That will be called as the basically infestation. Okay, so presence of an arthropod on the body surface, that will be called as the infestation. So presence of, basically this is the presence of an arthropod or presence of any kind of vector, right, on the body surface. Simple. Okay, let's try to keep our definitions so simple so that we can easily understand them, right? Okay, third thing is, let's talk about the contamination, right? So let's talk about the contamination. Again, in COVID era we came to know about the contamination very frequently, right? So contamination means usually we are talking about the inanimate things or the non-living object. For example, this pen might be contaminated, right? So that is the thing. So contamination basically the presence of an infective agent, the presence of infected agent or any kind of arthropod, any kind of vector on any kind of surface, right? It could be the non-living surface as well. For example, if the infectious agent is actually sitting on this particular pen, for an example, it could be contaminated, right? So that is the thing. So I can say that presence of an infectious agent again on body surface, right? But that might be non-living as well. That might be non-living as well. For an example, okay, let's write example as well. For example, it could be table, it could be pen, it could be a mobile, right? Anything guys. Okay, fine. Okay, etc, etc. Fourth important term which we need to know, that is the infectious disease in itself, right? So what is infectious disease guys? What is infectious disease? DISEASE. Okay, infectious disease guys. So infectious disease basically the presence of an infective agent in some person which is causing the disease, right? So infective agent in a person causing the disease it is called as basically the infectious disease. Basically, disease which happens due to any kind of infectious etiology in the person, right? So, infective agent in the host causing the disease is called as infectious disease, right? For an example, okay, your infective endocarditis, right? Infective endocarditis, isn't it? Next important term, right? Next important term, guys. So we need to talk about them, right? Contagious disease. What is contagious disease, right? These kind of terms might come in your exam as well, or generally also as a doctor, as a practitioner, you must know all of these terms, right? Okay, so contagious disease, basically this is transmitted by the direct touch, right? For an example, if somebody is sneezing on something, right? If somebody is sneezing on the mobile phone, okay, and now you took that mobile phone and using that mobile phone, right? So that mobile phone was contaminated. I told you the definition of contamination as well. And now you are using this. Due to that contaminated mobile phone, due to the use of contaminated mobile phone, this infection might come into your body now, right? That is called as basically the contagious disease. For an example, respiratory infections, right? And very important one, you might actually remember, or you don't need to remember even, that is COVID-19, right? Okay. So transmitted by the direct touch, basically. Okay, you directly touch that particular phone that was contaminated, and respiratory infection might come into your body, right? So transmitted by the direct touch, basically, that is the contagious disease. So it gets transmitted by direct touch to any object. Okay, it could be any object which is contaminated, basically. It could be any object basically that could be contaminated, right? Okay, so very simply I'm trying to define these kind of terms, basically. Sixth important terms that has been that came in your exams many times, okay, that is a nosocomial infections, right? Okay, and in medicines also, right? Okay, if you are working in the ward, if you are working in the hospital in the ward, or if you are seeing some kind of patient, okay, again and again, for example, you're coming to your duty in the hospital, right? And you're seeing the patient in wards, right? There are some patients who are actually, you are seeing them daily, for an example, for 4 to 5 days or for 7 to 10 days, right? Or some bedridden patients, right? So in these kind of patients, we might see the nosocomial infection, and there is always a risk for the nosocomial infection. And we as a doctor, right, we are actually trying to prevent that infection to enter into the patient body, right? So nosocomial infection, first of all, let me define it for you guys. Nosocomial infection, basically they are arising as a new infection which is occurring, very important, which is occurring after 48 hours of admission into the hospital. Options might be confusing in this case, right? They might give the options, right, within 48 hours of admission, or after 48 hours of admission, or before the admission, or after the admission. If it is after the admission, then after 48 hours of the admission. Okay, so look for that option. So it is not within 48 hours, it is actually after 48 hours of admission into the hospital. Okay, so be very clear with that. So guys, nosocomial infection, basically it is the new infection, right? So they basically arise as a new infection, right, which is actually coming inside the patient body after 48 hours of hospital admission, right? As a new infection which comes in the patient body after 48 hours of hospital admission. Okay, after 48 hours of hospital admission, right? So you should be very clear with the definition, right? Most common organism, if I'm asking you, okay, most common organism which can actually cause this particular infection, so that will be the Staph aureus, right? Everywhere, mostly we are finding the Staph aureus, Staphylococcus aureus, I mean, guys, right? Okay, now basically we are seeing them in the bedridden patients or the immunocompromised patients, right? So these kind of patients might be having the Staph aureus. Second point over here is that most common infectious disease which can happen, most common, if they are asking you, most common infectious disease which might happen in these kind of patient, that is basically your urinary tract infection, guys. Urinary tract infection. Why is it so? Because the bedridden patients, they are usually having the Foley's catheter inside the urethra, right? So due to that retained Foley's catheter, due to that retained Foley's catheter, right, retained Foley's catheter, this UTI might happen. For an example, more than 7 days has been already passed, and still the patient is having the Foley's catheter, or repeated change of Foley's catheter, right, that might also cause the urinary tract infection. So be very cautious while inserting or removing the Foley's catheter, either it is male or either it is female patient. Okay, always wear the surgical gloves. Fine, guys. Okay. Now, Staph aureus, why is it happen? Because usually if you are using the unclean hands, right, you are handling this patient and then you are going to another patient before disinfecting, without disinfecting your hands, right? So that might cause the that might cause the spreading of infection. So you should always disinfect your hands first of all, right? You should always clean your hands by using the sanitizers and all, right? And then only you should attend another patient, right? So always remember that. So guys, over here, if you're handling the patient with unclean hands, basically that is a very common cause of this particular nosocomial infection, right? Okay, guys, we have understood that. Now, exotic diseases. What are exotic diseases? So that have also been asked. Exotic disease, right? Exotic drink. Exotic means something that is coming to your particular country from outside, right? So it's kind of an import kind of thing, right? So exotic diseases which are not found, for example, if we are in India, these kind of diseases will not be found in India actually, but they are coming from outside. Those kind of diseases which are coming from outside, that is called as exotic disease, right? For an example, any kind of disease. So guys, yes, yeah. So any disease or infection which is not found locally, right? Okay. What could be the example over here, right? So example, for example, here you can say the rubella in the United Kingdom or yellow fever in India. Okay, these two examples you might remember for this exotic drink, right? For example, so exotic infection which is coming from outside, right? Which is coming from foreign countries or abroad, right? Okay, guys. Sixth one, that would be your basically zoonosis. So what is zoonosis? You might have studied them in your back in your biology time when you were preparing for the NEET UG, for an example. So zoonosis, guys, zoonosis basically, here we are talking about the disease which are either related to the some kind of animals or they are coming from the animals, right? Or we are talking about those diseases which are related to the animals. So diseases which are related to the animals, diseases which are related to the animals, guys, which are related to animals. Okay, fine. So which kind of diseases am I talking about, right? For an example, rabies, isn't it? So example over here, very classical example, guys, right? Rabies. Attended dogs which you might find on the streets, for an example, right? So if dog bite happens, right, so there is very high chances that the person might be getting the rabies, right? So that's why we should take the precaution for that, right? Okay, fine. So over here we shall talk about some of the examples, right? So based on the origin or based on the source, we shall talk about some examples as far as zoonosis is concerned. So guys, over here we shall talk about some examples. So based on the sources or based on origin, we are having some kind of types. Based on origin, we are having some kind of types over here. So let's talk about them as they have asked earlier, guys, as they have asked earlier. So first of all, I'm going to talk about that is zooanthroponosis, right? That is zooanthroponosis, right? Okay, what is zooanthroponosis, right? First thing. So guys, always remember, zoo means animal, anthro means human. So if this kind of term you are seeing in an exam, right? So this is basically transmission of this to that. How will you identify from which to which? Is it from human to animal or is it from animal to human? How to identify that? Very simple, guys. Just make this kind of arrow. It means from anthro to zoo. What is anthro? Anthro is human. What is zoo? Zoo is animal. So from anthro means human. So from human to animal, right? So if I'm talking about from human to animal, that is zooanthroponosis, right? So the transmission is from human to animal. I hope you're understanding, guys. Okay, so I'm writing like this. So from human to animal, if the transmission is happening. So from anthro to zoo, right? From anthro to zoo, it means from human to animal, if the transmission is happening, that is called as this one. For an example, guys, example, so that is the TB in cattle, right? So the human might have TB, obviously, it's very common in India, right? Okay, so from human, right, the cattle might be getting the tuberculosis, for example, TB in the cattle, right? Okay, guys, next one, very frequently these kind of terms are asked, right? So next one is just do the reverse of this, right? Just flip this term. So flip this term, that is called as your anthropozoonosis, right? That is called as your anthropozoonosis. So when I will flip it, guys, now you should answer me. From zoo to anthro, from zoo to anthro, that is your from animal to human, from animal to human, guys. Can you tell me the example? Yes, just look at your surrounding, guys. Look at your surrounding. In the streets, what you can find, and dogs for an example, right? If the dog bite will happen, that might cause rabies. That might cause rabies. Very nice, very nice. So that is the rabies is an example of anthropozoonosis, right? Very frequently asked, guys. Very frequently asked. Okay, guys. One more term I'm going to introduce you, right? That might be new to some of you. That is basically the amphizonosis. Okay, amphizonosis. What is amphizonosis? Okay, so what is amphizonosis, guys? Amphizonosis, basically this is, the transmission might be from animal to human or from human to animal. So vice versa, isn't it? So from the transmission might be seen from animal to human and from human to animal. So I'm making this kind of sign, right? So animal to human, human to animal, right? Animal to human, human to animal. So this kind of transmission will be seen in the amphizonosis. For example, staph or the strap infection. For example, staphylococcus or the streptococcus infection, right? So example would be like staphylococcus or the streptococcus infection. Okay, understood. Now I'm going to the one more important term that will be your, right? Okay, guys, so three types I told you based on the origin. I told you three types of your zoonosis. That was your zooanthropnosis, anthropozoonosis, and the amphizonosis. I hope there is no doubt in that. Okay, I'm further moving on. What is epizootic? Some people call it as epizoonotic, whatever you want to call it. Epizootic or epizoonotic, right? Epizootic type. In the epizootic, guys, very simple. If the outbreak of disease or epidemic is seen in an animal, right? So guys, over here what I'm talking about. So if the outcome of disease is seen, outcome of disease or outcome of epidemic, outcome of disease or outcome of epidemic is seen, in animals, right? In animals, then we are calling that as simply epizootic or epizoonotic, right? Okay, so what could be the example over here, guys? Example over here, for example, Q fever. Okay, example could be Q fever, or the example could be influenza. Okay, which you are finding very common viral infection, right? Okay, guys, next one which you can see over here, that is your enzootic, okay, or enzootic basically. So let's talk about that as well. So enzootic. What is enzootic? So outcome of a disease or epidemic in an animal was your epizootic. Outcome of an endemic condition, right? Or I would say those diseases which are endemic in nature in animals. Look, epi means epidemic, zoo means animals, epidemic in animals, en means endemic, zoo means animals, endemic in animals. So the diseases which are endemic in nature, right? So diseases which are endemic in animals. Very simple, guys. You can crack the answers by looking at the terminology which you are seeing in your term. Okay, so always try to break down the terms whenever you are seeing the medical terminology, right? And in 40 to 50% of the cases, you might get your answer, right? Okay, so example could be over here, right? Many kind of infections can be there. For example, anthrax can be there, or the staphylococcus infection can be there, right? So here I am taking the example of anthrax. Fine. Okay. Now, what is epidemic, what is endemic? I will come to that. Don't worry about that thing. Okay. Fine, guys. Now, moving on to the next term over here, that is your sporadic. That is your sporadic. Now, sporadic, the term which you need to look into your MCQ, if they want to ask you about the sporadic, that is the scattered or the haphazard. Okay, these kind of terms you should be looking for. Actually, what is sporadic? Basically, disease which is occurring in a haphazard manner, or disease which is occurring in an indefinite manner, or disease which is occurring in a scattered manner, that is called as the sporadic case. Okay, so diseases which are occurring, diseases which occurs in haphazard manner or irregular or scattered manner. Okay, these kind of terminology you should be looking for in your MCQ, right? If this is mentioned, okay, so they are asking you about the sporadic cases, right? So that is called as this one. Okay, for an example, tetanus. Okay, got it, right? In some cases, they might tell you that there is sudden decrease. Okay, if you are seeing in the population, if you want to correlate this sporadic term to the real idea in the population, right? If there is sudden decrease in the number of cases, if there is sudden decrease in the number of cases, right, without any valid reason. For example, generally in the population, I am seeing that in a week, in a particular week, I am seeing that 100 cases are seeing very easily, right? For example, dengue fever cases you are seeing, and 100 cases are coming very frequently in a week. But next week you saw that only 10 cases came, right? So this is kind of a decline in the number of cases without any kind of valid reason, right? There were no measures taken, for an example, and still you are seeing just 5 to 10 cases in the next week. So it means sudden decrease in the number of cases without any kind of valid reason. That is the sporadic kind of case, right? Sporadic case example. So you might remember like this. So sudden decrease in cases without valid reason, right? Okay, so these kind of things might appear in your MCQ, right? So this kind of language they might use in the MCQ. Fine, guys. Next one is epornithetic, right? Epornithetic or epornithic. Okay, epornithic type. Fine. Here we are talking about basically the diseases which are occurring in the birds. The diseases which are occurring in the birds. So basically, diseases which occurs or which are endemic. Okay, or I would not say endemic basically, but disease which occurs in birds. Okay, that would be fine. Disease which occurs in birds. Okay, that will be called as your epornithic, right? Okay, or example over here I shall take, that will be your very famous one, that is psittacosis. P is silent over here, that is psittacosis. Okay, fine. For an example, psittacosis. Next term which you should know, that is the endemic, guys. Endemic and epidemic and pandemic. These three terms are very, very important for the MCQ. Okay, and for your basic languages, for your basic knowledge as well. So basically, guys, let's talk about, I'm just highlighting this with the bold letters now. These, what is endemic and epidemic and pandemic, right? So let's look at the difference between these three important terms. So if you talk about the endemic over here, guys, basically this is the constant presence or the usual presence of any kind of disease in a community or a population, right? So constant presence or usual presence, right, of a disease in a community or population, right, in a community or population within a geographic period or within a geographic area. That is called as the endemic, right? Endemic type, right? So epidemic disease or the endemic disease. So what are endemic disease? Constant presence or the usual prevalence of a disease, right, that will be seen within a geographic area, right? That is called as the endemic diseases, right? Okay, for example, many kind of endemic diseases you might see around. That is, for example, you can see the hepatitis, or you might see the HIV, or you might see any other kind of disease also. They are very common. So example, I might write over here as well. Okay, so they will be, for example, typhoid you can see around, right? Or hepatitis, for example, hepatitis A is very common, right? So these kind of diseases. Now, next one is the epidemic, guys. Next one is the epidemic. In the epidemic, basically, we are talking about the sudden or the gradual rise in number of cases, right? So guys, be very clear with this definition. Definition says that sudden or gradual rise in number of cases, sudden or gradual rise in number of cases, right, which is beyond your expectations, right? You were not expecting, for example, 20 cases were seen, okay, or for example 100 cases were seen of some particular disease in your community or in your area, right? You are a PSM doctor over there, right? And suddenly next week you came to know that 1000 cases are appearing in your area, right? So that is kind of alarming situation, right? So this is called as the epidemic disease in your area, right? So you have to work out, right? As a doctor over there, you have to work out over there, okay? You have to work out the disease, you have to confirm that whether it is epidemic or not, right? And accordingly you should make a report and submit it to the government. Okay guys, so sudden or gradual rise in number of cases, okay, without your expectation or beyond your expectation, that is called as the epidemic, okay, which is either more than 80% of frequency or more than 2 standard deviation. Okay, that is the definition of the epidemic. For an example, you might take the example of what? For example, COVID became the epidemic, right? Fine. So COVID became the epidemic in 2020, right? Okay guys. Now next one, which I'm gonna take over here, the example, the disease. Endemic we have talked about, epidemic we have talked about. What is pandemic? What is pandemic, right? And again guys, COVID became pandemic as well. So over here, what we are seeing basically those diseases or those infections which is actually occurring in a wide area, okay? So the epidemic diseases, which are occurring in a wide area, which occurs in a wide area, or I would say wide area, or crosses the geographic boundaries, okay? So that is called as this one, or crosses the geographic boundaries or crosses the international boundaries. For example, again COVID, it started from China and then came to many countries, right? So crosses international boundaries, okay? That is basically called as, right? So that is basically called as your pandemic, right? So usually affects a large number of people, okay? So it usually affects large number of people. Fine. So that is your what? That is your pandemic. So we have talked about epidemic, we have talked about endemic, we have talked about pandemic, isn't it? Now the next point which we are going to talk about, that is your the infections. We have talked about, like basically this is the entry of an infective agent into the body, right? Now if you talk about what is basically the opportunistic infection, right? Opportunistic infections are very easy to understand. If any kind of infective agent will be finding the opportunity to invade or to get the entry into the host, that is called as the opportunistic infection, right? For an example, pneumocystic jerovesy, right? Or there are many examples, right? For an example, let me mention it over here only. So what are your opportunistic infections? What are your opportunistic infections, right? So let's talk about them as well. Very simple to understand, guys. Again, opportunistic infection means, okay, so infections or infective agent, okay, so rather I would like to write the infective agent, okay, so infective agent, right, getting entry into the host, okay, in any opportunity or whenever gets opportunity, right? So what is the opportunity in this case? For example, any kind of immunodeficiency, or it might be the immunosuppression. immunosuppression. Okay, so whenever body is getting immunodepressant, okay, or I would say whenever the body is getting immunodepressed or immunosuppressed, okay, or for an example the patient is taking steroids for a longer period of time because they are immunosuppressant, so immunity will be going down in that case. So there are many opportunistic infections are present in our environment, right? For an example, let me give an example over here, okay, and I will take the very important and very common examples. For example, TB, right? So TB might be actually occurring in the people whenever this Mycobacterium tuberculosis, whenever it will be getting an opportunity to find to go into the body, it will be actually invading into the host, and they will be actually proliferating over there and will be starting to show signs and symptoms, right? For an example, if your immunity is weak, right, many other infections can be there. For example, pneumocystis jirovecii in the HIV patients especially, right, that might also be seen, right? So over here I'm taking the example of, for example, pneumocystis jirovecii, right, or varicella zoster virus, right, that might also be seen in the adult age group, right, whoever has been suffered from the chickenpox in the childhood, right? So whenever their immunity is getting weak, opportunistic infections can prevail over there. Okay, guys, with that, cytomegalovirus, right? So these are some of the examples which you can remember for your exams as well. Okay, guys, now I'm moving on to the determinants of the host, guys. Okay, so we have talked about till now the infective agent, right, how it is getting the entry and what are the different terms which we have studied, which we can study related to that. So for example, we have talked about the contaminants, we have talked about the contagious disease, infective disease, infection, what is the infectious disease, what is the nosocomial infection. Then we came to know about the zoonosis, right, zooanthropognosis, anthropozoonosis, right, amphizoonotic. Then we have talked about the exotic diseases, we have talked about the endemic, epidemic, and the pandemic, right? Okay, so we talked about so many terms related to the infective agent and how is it causing the different kinds of things, right? And now I'm gonna start with the host, right? So the problems with the host, what are the problems with the host which we are dealing with? Now let's talk about that. So we have talked about the infective agent which is causing the disease in the host, basically. So infective agent is done. Well, now I'm going to the problems with the host, right? Okay, so guys, let's talk about the determinants of host. So once the infective agent is inside the person, inside the host, now let's talk about what are the different things which we can talk about. So guys, determinants of host. Okay, so determinants of host, let's talk about that as well. Okay, guys, so basically we are talking about, on a very broader level, we shall talk about the three types basically. Okay, so what are these types? So first one we shall talk about, that is basically what is primary host. Okay, so these are very important terms and could be your direct MCQs. So what are basically primary host? And if you guys remember, I have already talked about this in the previous sections as well, right? Basically, importantly in the epidemiology sections, right, where we have talked about the primary case and the secondary case, right? So primary case is the one which I told you over there as well. The primary case is the one which is getting the disease firstly in any kind of family or in any kind of community, right? For example, there are 6 members in the family and one member is already sick, that is the primary member. And with that, if the infective agent from that particular person transmitted to the other person and 2 more persons are also got that particular disease, right? Now these will be the secondary case because they got the infection from the primary case. Okay, so with that idea, let's talk about the primary host over here. So primary host, basically guys, this is basically the definitive host. Okay, the other name of it is the definitive host. Okay, this is the definitive host, and basically this is the host in which the parasite is actually passing through the maturation stages, right? Or I would say basically in this stage the host is basically going through, or the parasite actually is going through the sexual maturation stages. So basically this is the stage where this is a host in which parasite achieves or passes through its sexual stage of maturity, right? That is called as your primary host. Okay, if you talk about the secondary host, guys, this is called as your intermediate host. Right? This is intermediate host. Okay, sometimes they ask you What is the definitive host? Is it primary, is it secondary, or is it something else? So intermediate host is your secondary, definitive host is your primary, right? For some kind of infections, humans are the definitive host, and for some kind of diseases, humans are the actually intermediate host as well, right? So secondary host, if you guys talk about, then we shall say that, here, this is the host in which parasite do not achieve the sexual maturity, right? In the primary host, right? In the primary host, still any kind of parasite might achieve the sexual maturity, but in the secondary host, it do not achieve that, right? Basically, this is a host in which parasite exist in the larva stage or the asexual stage. Mind it, asexual I am saying, in the larva stage or asexual stage. Okay guys, so very simple. Okay, now next kind of host which I shall talk about, that is the obligate host. That is the obligate host. Okay, so what is the obligate host over here? This is the host which is the only source of development, right? So this is basically the host which is only source for development, okay? So if the infective agent is not finding any way, right, to go into any other kind of host, that is called as the basically obligate host. So basically this is the only source of the development, that is the obligate host. For an example, typhoid, for an example, your measles, right? So basically these are your examples, could be typhoid or measles, right? Typhoid or measles, right? So we talked about the obligate host as well. Now there is one more important host, that is your dead end, right? That is your dead end. For example, you are traveling your vehicle, right? You are actually going on a road, okay, with your car, for an example, and you might see sometimes there is a dead end, right? And you need to actually take a U-turn from there, right? So that is the dead end. That is the meaning of dead end, right? So which means there is no way beyond that. So basically, this is also the dead end where the person-to-person transmission is not there. For example, in the COVID, there was active person-to-person transmission, right? And that's why we wanted to achieve the mass vaccination. So that we can actually immunize the majority of the population, and so that person-to-person transmission could not be done, right? So that is the idea basically behind the massive immunization program as far as COVID-19 is concerned, right? Okay, so basically here person-to-person transmission is not seen, so no person-to-person transmission, right? Or rather I shall write like this. So basically here the person-to-person transmission is not seen. Person-to-person transmission is not seen over here. Okay, fine guys. Now, for example, humans are the dead end host for some of the important diseases, right? So example over here you should mention, for example, rabies, right? Tetanus or plague, right? So these are some of the examples, or trichinosis. So these are some of the examples which can be actually the examples for dead end host, right? Okay guys, so with that, let's talk about one more important term, or rather I should say two more important terms. These are your reservoir and the source. Okay, so what is reservoir and what is source? So I'm using the different color over here. So guys, what is reservoir? Okay, and what is source? So first of all, let's talk about the reservoir only. So reservoir, basically this is the natural habitat of an infectious agent, right, which can be working as a transmission of this particular agent into the different kinds of host, right? So basically this is the natural habitat of any infectious disease. Okay, so natural habitat of any infectious disease or any infectious agent, right? And what it will be doing basically over there, it will be growing itself, which grows and multiplies inside it, okay, and can be transmitted, right, further, and basically further can be transmitted to other host, or I would say transmitted to susceptible host, right guys? Okay, so this is the reservoir. Now source, what is the source? Source is basically similar to this term, but basically difference over here is that this could be any kind of living entity, or this could be any kind of non-living entity also. It could be human also, it could be some kind of inanimate object, okay, or it could be some kind of non-living object as well, right? So any living or non-living entity which is acting as a immediate mode of transmission, right, that is actually your source, right? So basically, so what is source? Basically any living or non-living entity, any living or non-living entity which is actually acting as, which acts as immediate mode of transmission, immediate mode of transmission. Usually we ask generally, right, that what is the source, right, what is the source of this disease, for an example, right? That is the thing. So for example, from the source it might go into the reservoir, it will be growing itself and multiplying over there itself, and then it can transmit to some other susceptible host, okay? So there will be the source, then there will be the reservoir, and then it can transmit to any other susceptible host, right? Okay guys.